We created this program in 2022, Organizing for Public Health Leadership Academy, to really bridge the gaps between the traditional public health field and community organizing.
It's been a space that has been liberating, a space where we can talk about the change we want to bring in our community in the terms of how we see them. It was through a partnership with PHC and the connections that we made with the folks at CPEN that we received some technical assistance and statewide coalition support to get some of the American Rescue Plan Acts to ensure that funds were spent for essential workers, parks, and for investments in our community and in the human infrastructure. And those things were only possible because of our collaboration with CPEN.
The knowledge that I had been gaining and all the work that we've been doing in this Public Health Collaborative, when I was, in strengthening my relationship with Public Health Department, and you need to find an ally, right? Finding that champion in there and being able to have all those pieces together allowed for us to be in that space. A lot of the folks in the room are county health departments or county departments, folks at the city level, or just larger organizations, but not community based. So also being able to be in the space, recognizing the privilege, but now looking ahead and envisioning what the next steps and what 2024 will look like. How do we create the space for the others? Again, with all the knowledge and everything that we've been gaining in this Public Health Collaborative.
And so since even the retreat, we've definitely been able to build even more with Incarcerate Sacramento, for example. We've met even outside of the collaborative to have coffee and really understand what are the alignments in our existing work already to how can we build structure and infrastructure to be in closer proximity, but also alignment and aligning resources and aligning opportunities together.
I would have to say all of them were good. I think anytime that you can, as CPEN, bring in folks who are actually in those positions, it really opened my eyes to say, okay, what's the inside strategy and what's the outside strategy? A lot of times, we are in this fight up against systems, but we have to also remember that there are folks who are within those systems who are our allies. So how is it that we can best position ourselves to have those conversations, to then move those needles so that there isn't that status quo that sits within those seats of power that sometimes are kind of stale within government. So I think that was really helpful for CPEN and the Public Health Collaborative to really make a concerted effort to reach out to those individuals so that we could have those dialogues in some of our workshops and our trainings.
Strengthening partnerships and strengthening opportunities and really building an ecosystem that continues to support each other, whether that is across different ethnic or racial communities or whether it is in locality. And it's been really great just to build these relationships in a way where you can trust the intentions behind the partnerships and be able to actually turn these trusting partnerships into transformative organizing action.